as some of you know, I was Amy's physician, and one of the things that really stayed with me, she had a disease course that was really rough, and she suffered from this terrible disease. But as I was sad about seeing her, that the cancers come back despite all the things that we are trying to do, she consoled me instead of me helping her. I remember she was in my clinic once, I don't know if you remember, Jason. And then she took my hand and said, "It's okay." I mean, all of you who don't remember, it's so Amy to do this, and she had so good humor. And even if things were bad, she still knew somehow humor helped her, and I think that's what we can all learn from her, to get over challenges. And the second aspect of my research looks at how can we find ovarian cancer early. And since it's difficult, just think about the ovaries in a woman about this size. And it takes a lot of growth, so it has to go to this size to push in front on the bladder or push on the bowel in the back to cause any symptoms. And most women are tougher than we guys, Jason, I'm sorry. So they just ignore their symptoms. So that also contributes to the delay, where it takes about 9 months to have from the onset of symptoms to reaching a GYN oncologist. So our hypothesis is that in the blood, there must be markers that are secreted, like shed by this tumor, that can be detected then by methods to give us an early hint that something is happening. Now, I'm lucky to live in these times because, as you know, there's a lot of modern technology now. So technology that can detect 500, 800, 1,000 proteins in the blood at the same time. So we're trying to make it very, very easy and lower the threshold that it takes for a woman to get a test. So we're trying to develop a test where we can diagnose ovarian cancer early. But the problem is ovarian cancer is on nobody's mind. Most senators are guys, so they care about lung cancer, prostate cancer, and it's very, very little of the research funds goes towards women cancer. Dr. Danzi just talked on our way here, like ovarian cancer, endometrial cancer, just really underfunded. And then if they fund women's cancer, they fund breast cancer. You see those buses and garbage cans with pink, and it's all over breast cancer because we almost cured breast cancer. 85% of all women who have breast cancer will not die from their breast cancer. While 85% of all women that are diagnosed with ovarian cancer will die from the cancer. So you see the difference. There's a highly deadly cancer, and there's very little funding for it. So foundations like yours will allow to go after crazy ideas. In grants, they say they think out of the box, but some of those ideas are. But that's what you need, is you need really ideas. We can't just wait 20, 30, 40 more years. We need something now, and that requires a certain paradigm shift. Support from you will allow for this to happen. We have the technology, we have the bright minds to do this, and we have the research question. So those three together with your support will make this happen during our lifetime.